to know when we lost our vision of what's doing best for our
The common
people.
good, the common
Yeah, and
good.
serving your constituents, that's what I wanna know. What happened to that idea, that you're elected to a seat in our legislature and you are to be concerned about your constituents?
It's because money is
Yeah.
driving
Yeah,
their answers. I do,
Yeah.
and they
It
are
does.
so fogged over because of who they have to keep happy somewhere away, who's got this huge pipeline of dollars to them.
Mhm.
I do
Yeah.
believe that is the,
yeah, it's,
And poor people don't have clout.
They don't have
they don't have
clout.
clout, yeah.
Yeah.
Mhm.
So we have to do this.
Yeah, we
But
have.
do you feel like it's been this way for a long time and I'm just seeing it, or has it gotten worse?
no, I think the group is growing. See,
Okay.
that's
Yeah.
what when a few years ago, very, very, planned, Republicans voted out their own, they put money into other candidates to knock out their moderate
Mhm.
Republicans. I think that was a huge turn for
Yeah.
us. Which
Okay.
now was probably, what, 6 or 8 years
Yeah,
ago?
it was in 12, it was in 2012, was one year
But
they
they made
purged,
a
they made a
purposeful
big
point
purge.
to put the X on a number of people around the state to knock them out of the Republican Party, out of their seat
Mhm.
for a much more conservative, totally uninformed,
Mhm.
just a puppet.
Just a puppet, yeah.
And I really think that's when that began to change dramatically, honestly. And I was a state employee for 36 years, and at that point too, being in state service was no longer viewed as a worthy occupation.
Mhm.
That we, our pay never matched probably what we could have done in the private sector, but we had good benefits, and I think people who stayed felt, good about what they were doing.
Yeah.
For their communities, for the state. And the government, the Kansas politicians and the governor kicked people to the curb. And all of that was going on at the same time with, and teachers started getting blasted, and that's never changed for them, certainly. But they used to be honorable positions,
Absolutely.
not so much anymore,
No.
and arguing about every penny and how it got spent. But I really think it's the big dollars out and away, wherever, all this money that can be spent
It's
in
the
these
dark
PAC groups.
money.
I really do think that sounds kind of like a conspiracy theorist, but
No, it's
I
true.
It's not a conspiracy if it's true.
It's true.
And
Yes,
it has played out quite a bit in these now 8+ years, I think, in our state. And now we see,
Mhm.
the kooky legislation that they spend their time on. It's like, I couldn't dream that up if I drank for 3 days. I couldn't dream it up. I mean,
Yeah, it's insane.
they pick these obscure small groups of people who are different,
Mhm.
and they pick on them, and they
Mhm.
make huge cases that it's like, based on what? Why wouldn't you wanna deal with something important that affects and could improve for lots of people? Why would you single out? And they spend such great time, but I do think it's big money somewhere else is pulling the strings, and we are the losers
We
for
are.
it. We really are the losers, and
Yeah, and I think the whole, that system does not make for people, it makes for politicians.
yes,
I mean, when
we
you have to
lose.
depend on money
We lose so
go
much
to-
out of that.
to be elected each time.
Well,
If you're gonna be a statesperson, you will say what your values are, but you'll be elected, you'll be gotten rid of.
Oh, yeah, well, and we had a very long time, great House rep here for the 79th district, Ed Trimmer. He had been a longtime teacher and debate coach at
Okay.
Winfield High School, just incredible debate coach. And he got into his seat after the death of the current person.
Okay.
And so he served 14 years and then was knocked off by Cheryl Helmer 2 elections ago. And his name was Ed Trimmer. So he's been back teaching again over in Burden at Central USD. And Anita Jignans was in the 80th
Yep.
rep seat for one term. And she got knocked off with Bill Riley. but she was a moderate Republican. She was,
See, she got it, I mean.
Yeah.
she got the axe, and at the same
Yeah,
time in
made
El
too much
Dorado,
sense.
another
You know what I'm saying?
educator,
They couldn't take her.
Mary Martha Good, really excellent person, and she got knocked out in the same race that Anita did, and they were all, those were moderate Republicans, but Ed was a Democrat, but he lasted 14 years,
That's awesome.
and then the wheel, the Republican wheel just rolled over him,
Yeah.
and they haven't looked back because they really decimated the Democratic candidate this last time in November.
And the people you're talking about that were in there, you could have an intellectual conversation.
Oh,
with.
yes.
Oh, God, yes.
And they knew their stuff
Oh, yes.
up and down. Let me tell you, Anita
Ed was
Jenkins
incredible.
is incredible.
He could explain stuff that you could actually understand, and
Yeah.
he needed to, but Cheryl, not so much.
No.
Yeah.
Well, first of all, she.
Yeah, we've had some
Yeah,
good
she doesn't-
folks,
she
but they
doesn't
just
like-
haven't been
She
able to
doesn't like to
last.
take any questions.
Were you guys at the Burford when Cheryl was there?
Oh, yeah. Mhm.
Yeah.
That was a fun day.
Totally scary, scary.
Well,
You know-
anyone else have a question for Jeff or make any comment? We want to show a little video.
Sure.
We want to show the little video. It's a new
Is this
document.
Fredericksburg?
No, it's the Wellington.
Oh,
one.
Wellington, okay.
But yeah, I wanted to hear your comments about Fredericksburg. I thought
I
that
love Fredericksburg.
wasn't that incredible?
Yep.
I knew that because you've been so active here with us that video would really make your day.
Absolutely.
That was
It was a great
impressive,
video.
wasn't it? Yeah. Okay, this video, let's see, Kansas Alliance for a Healthy Kansas called me some months back and was wanting some names of different people, Medicaid enthusiasts in the Wellington area. And they were working with, let's see, I think it's the Commonwealth Fund. Anyway, they produced this video. Didn't really have any of the people that I had given them, but it's a good video. It's about 5 minutes long, and it talks about the Sumner County Medical Center's demise in, it was March of this last year. And this just came
Oh.
out.
Put the light back on.
Oh, sorry.
I
You
lost.
planned this well. It's actually the day that they closed today.
Oh, is that right?
March 13th
It's
today.
incredible.
Yeah.
We did watch this video earlier today.
We lost the internet. We'll get it back.
Oh, okay. So we'll do it again.
Hold on. I need the light.
Okay. Yeah, we have had a little trouble occasionally with the internet in this room. Well, anyway, if you would like to communicate with our legislators, I have the information here on this sheet. If you want to write them, I have their phone number, their office phone, and their email address. But if you want to write them an actual
You can.
letter,
This is the main lobby where you come in, you check in. I took you to radiology and the emergency room. Patient rooms, a nurse's station down here. There used to be an OB unit down on that end. This is the first time I've been inside here since it closed in March of this year. Yeah, it's sad to see that there's no staff moving around, the lights are on, there's activity going on. It's a loss for the community.
Of course, this was made possible by the painstaking work of members of this administration, including our outstanding Secretary of Health and Human Services, Kathleen Sebelius.
Part of the goal of the health bill was to look at the slice of the population who were uninsured and try and figure out what was the most effective way to get that population insured. For the lowest income individuals, Medicaid was by far the best way to offer coverage. It was a system set up in every state. There was a network of providers in every state. You could put that together in every state very quickly and just expand the eligible population. I don't think anyone ever imagined, with free money on the table to insure this group of individuals, that any state would say, no, I don't want your money. You know, no, we're just going to leave people uninsured. That had not even been talked about as a possibility.
There are so many examples and so many stories that we hear, and I just can't believe that really the citizens of Kansas can ignore this.
It's illogical, it's unreasonable, and it's immoral what they're doing.
Wellington is the 5th hospital in rural Kansas to close since 2011.
We have seen a number of hospitals close, not just in Wellington, but in other communities in Kansas. And while expansion probably isn't the only thing that's needed to help them, it certainly is a big first step.
Two things happened in March of this year. You have the hospital closed, and then there's COVID-19. We have a large elderly population. They rely a lot on healthcare, and that makes them have anxiety when there's not a hospital here to go to. They just didn't want to go 30 miles away. They didn't want to go where COVID was. They didn't want to go to a hospital where they couldn't have any visitors.
I really see it as a practical issue. We have an opportunity for the federal government to pay 90% of the cost of getting insurance coverage to more Kansas consumers, and in turn getting more payments to our providers. The fact that politics has gotten involved has really just been to the detriment of the state of Kansas and our providers and consumers.
There's nothing more heartbreaking than an outreach worker during an open enrollment who has to say to an individual, you don't make enough money to qualify for a federal subsidy in the marketplace, and your state has not yet expanded Medicaid, so there's nothing I have to offer you except the free clinic down the road.
Everybody should have access to health care. I don't care, what your income level, who you are, you should have access to health care. And a lot of these people are falling in the gap.
So Via Christi has opened the ER in the hospital. So they do have an ER, and that way it serves the community that way, that if they have an emergency and they need to transport them out, they can transfer them on to Wichita. So at least that's a positive thing that's happened there.
Right.
It's so sad to see all that infrastructure,
Just
nothing
sitting there.
happening.
See,
And every year
Yes, I
it
agree.
just wastes away.
Well, we went up and toured it, and we bought a lot of the equipment and stuff from the auction. And it's very eerie to walk into a closed hospital. We did the same thing for the hospital that closed out, and I can't remember the name of that one that closed, but yeah, 5 hospitals closing, and we only had 120 in the state. So it's a significant loss.
Yeah, totally. Well, since you've been visiting with Harper and Anthony Hospital, how are they doing over there?
They're doing well. They have a nice little hospital, brand new, and Pat is actually from Texas as well, and so he's done a lot of positive things there.
So they're holding their own over
They
there?
are.
That's good.
Yeah.
That's good. And where do they send, I guess they send their orthopedic patients normally to Wichita, but you're working to get them to come to Ark City, which is great.
Right, so we'll be, they'll send any emergency orthopedic tests, and then if we have hip the recovery on the hip replacement, so we swing them back there. So we'll keep them, stabilize them here, and then swing them back and with them.
Yes,
They'll be in their home hospital. So.
right, because they have to be back in the hospital for a while. I
And we
guess.
want them to get that 59 cents off of every dollar.
Yeah, right,
They're
exactly.
Citizens.
Exactly. So anyone, any comments or anything about the video? It was sad, the building just sitting there, although part of it is being utilized, I guess, as an ER, so that's good.
And they're gonna open up a small part of the family practice clinic there, Via Christi is.
Oh, okay, well, that's good, that'll help a lot too, absolutely, great. Okay,